it took me 12 years of doing temporary fillers before I actually decided to do permanent fillers. And the reason for this is that you have to get to a certain stage of confidence where you know you can put in a permanent filler and put it in perfectly 99.99% of the time without making a mistake. It's a bit like when you're in primary school and you have to graduate from pencil to pen. They don't give you a pen license until you are really good with working with a pencil. And it's for the same reason. There is no eraser for a permanent filler. The temporary hyaluronic acid fillers have got a reversal agent called hyaluronidase, which is an enzyme that very easily breaks down the hyaluronic acid. So there is more room for error. And over the years, I've done hundreds of filler dissolves on temporary hyaluronic acid fillers because something wasn't quite right or there was a problem. And thankfully, there's that reassurance that you have with temporary hyaluronic acid fillers that you can reverse them. Permanency of fillers may be a cost saving or a convenience for many people, but given that over the past year or two, we've been understanding fillers better, temporary fillers that is, and realizing that hyaluronic acid fillers can last for 5, 10, maybe more years. And we've seen this in our MRI studies that we've performed recently on our patients. The question is, do we need something that is more permanent than this at the expense of being irreversible? Plus the added pressure on the doctor performing the procedure. There's no room for stuff-ups here. Zero. It's going to last forever. When I'm doing permanent fillers myself, I really sweat it out. I mean, I do it in a sterile environment firstly, so I actually take my patients to an operating theatre to do permanent fillers to make sure it's extra clean. Permanent dermal fillers are more susceptible to complications if bugs are introduced. And really, it takes me twice as long to do because I'm really, stressing about placing the filler as carefully as possible. There's no room for error here. So there's really a lot of pressure on the doctor. It saddens me that I actually have seen quite a number of cases come in of people who had permanent filler, often many years ago, and those lumps or those problems that they had when it was injected are still there. They've just lived with it because there's no way to reverse it. I actually know a patient who had permanent dermal filler in her nasolabial fold. She had infection afterwards, it was lumpy, and she ended up getting it surgically cut out, leaving a scar on each nasolabial fold. One of the other problems with permanent dermal fillers is that they're generally made of more permanent substances which are not naturally found in the body. So temporary fillers are generally made from hyaluronic acid, which is a natural constituent of your skin, your joints. It's in our whole body, really. It's found throughout our bodies. Permanent fillers, on the other hand, are actually recognized as foreign substances by the body and often set up an immune response. The body detects the permanent filler and picks it up as a foreign substance and tries to get rid of it. So permanent dermal fillers have a lot higher risk of what we call granulomas, which is basically the body trying to get rid of this foreign substance. And the way it's determined whether you have a granuloma or not is by the presence of what we call macrophages, which is the body's Pac-Man cell to try and sort of get this dermal filler out of there. And what it presents as clinically is a hard lump, often red, where the filler was injected. Treatments for this are difficult. They often require a cortisone or steroid injection into the filler. And if that doesn't work, sometimes surgery is required to remove it. The risk of this sort of problem occurring with hyaluronic acid fillers is a lot less. The body doesn't tend to recognize it as a foreign substance as much. And millions of these treatments are performed around the world. Another complication of permanent fillers, which is also a complication of temporary fillers that I always worry about, is the risk of intra-arterial injection. That is, injecting the filler into an artery which supplies a part of the face or even the eye. And if you inject a permanent filler into an artery and you notice that there is some lack of blood supply to that particular area, there's no way to actually dissolve that filler and return the blood supply. For example, if a temporary hyaluronic acid filler is injected into an artery and the practitioner notices the signs of vascular occlusion, that is like a mottled like levator reticularis pattern, which looks like this picture here. We have the option of putting in hyaluronidase, which can then traverse through the artery wall, dissolve the filler inside the artery, and potentially recover that blood supply. Although uncommon, if this does occur to the blood supply of the retina or the eye, with a temporary dermal filler, you have some chance of reversing that blockage and returning vision to that eye. Now, I'm talking about very, very extremely rare circumstances here. The risk of blindness is extremely, extremely low, but it is a potential complication that can be averted through having a dissolver. The risk of injection into an artery which supplies an area of skin, for example, isn't as rare as going into an artery that supplies the eye. I mean, there are arteries throughout the whole face. The fact that you can have reversibility for those circumstances is very reassuring in particular. But I still get a lot of patients inquiring about permanent dermal fillers. And I think the allure of the cost saving potentially, only having to do it once, it is very powerful. But the question is that convenience or cost saving worth the potential safety risks? And nowadays we have to question that even more, because we recognize that temporary hyaluronic acid fillers potentially last a lot longer than we initially thought. So they're not lasting 6 to 18 months, and we're finding they're lasting more like 5 to 10 years. So where are permanent fillers good? Well, there are certain circumstances, although not many. There are certain circumstances where you want to do something once, and you want to do it once and do it right once only. I think a good example is fixing like a post-rhinoplasty deficit in the nose. So for example, you've had a rhinoplasty and the doctor has taken out more of your cartilage or bone than should have been taken out, and you've got a bit of a dip, which you don't like, for example. That's a great area for a permanent filler. So you can put it once in there and then not have to worry about, say, getting a rib graft or some sort of graft to put the volume back in. Especially if it's just a small deficit. An area like a nose to inject with hyaluronic acid filler can often be problematic if you have to inject it more than once, because the risk of having to inject the nose is associated with blindness, and if you were to do it multiple times, that would double or triple or quadruple your risk. Whereas if you can do it just once with a permanent filler, that's perfect. The other area which may be a good spot for permanent fillers is atrophic scarring. So scarring possibly from acne or some other cause where you've got a little divot in the skin and you want the filler to be there for a very long time. So permanent fillers are not a bad option for scarring. So it's really only meant for specific areas in small amounts. And some of the disadvantages, other than the ones I've mentioned, include the fact that once you have a permanent filler, you can't really mix it with a temporary filler or something else, or another filler of any sort, because there is too much of a risk of infection or developing a complication or sequelae from mixing fillers. I think the risk is a lot higher if you're mixing permanent fillers with, say, temporary fillers. If you have a technically difficult area, for example, like the tear trough, that's an area you definitely want to stay away from permanent fillers. Any extreme treatments where you're pushing the boundaries, I don't think you should be doing extreme treatments anyway, but if you are doing that with hyaluronic acid fillers, you at least have the option of reversing it. Say the fashion of lips goes out of trend, for example, you're not stuck with gigantic lips for the rest of your life. I've seen this a few years ago when a patient had permanent filler in her lips and kept going back to the practitioner and pushing them for more and more, and they ended up with these gigantic lips, which really, you can't look at anything else in her face. And the only way for her to fix that now is to have surgery to cut those fillers out. Permanent fillers are are actually very unsuitable for those with global volume loss. That is, you can't put in mil after mil after mil of permanent filler to cover the whole face. Firstly, I mean, it would be extraordinarily expensive. I mean, permanent fillers are naturally about twice as costly as temporary fillers per mil. But that's not the main point. The main point is that it would be almost impossible to get a very nice natural result without lumps, without unevenness, asymmetry, using permanent filler. It's hard enough with temporary filler to fill large volumes in the face. Generally speaking, fillers are not really meant to be used in large volumes over the whole face. I think if you have generalized volume loss, then what you should be using is fat, your own fat that is, transferring fat to the whole face, or using a collagen stimulator. It can be placed over all the areas of facial volume loss, and that is a good way to replace generalized volume loss. So in essence, I'm not saying to not use permanent fillers at all. They have their place, but I think in today's day and age, with our knowledge about the longevity with hyaluronic acid fillers, there becomes a smaller and smaller niche for permanent fillers to be used. And we really have to be ultra specific with who does them and where we put them. I'd love to hear from you about what your thoughts are on permanent fillers, and maybe you could share with us if you've had permanent fillers before. Tell us how much you've had and which areas you did, and whether the results were good or not. We'd love to hear from you, and let's start the discussion and talk about it in the comments section. I'll see you in our next video.